Hello, I'm Dr. Jeffrey Watson. Welcome to this special edition of the Healthbeat Show. We are talking about COVID-19 in the African American community. Today, I have one of the community's specialists in this area, in none other than Dr. Kim Rhodes. Welcome to the Healthbeat Show, Dr. Rhodes.
Thank you, Dr. Watson, for having me.
Thank you so much for coming. Now, tell us a little bit about yourself, your background. How is it that you evolved into working with the COVID virus?
My real sort of day job is actually in cancer. My background is that I have an MD. I trained in surgery, so I'm board certified in colorectal as well as general surgery. I practiced in that field for about 8 years on the faculty at Stanford. During that time, most of my research focused on disparities in cancer survival, and I started the community engagement program at the Stanford Cancer Institute. When I left there, I was recruited to lead the community partnership work, the Office of Community Engagement at the UCSF Cancer Center. And that was going along swimmingly. I was making a lot of partners and doing a lot of work, making sure that our research on our campus reflects the needs of the community and addresses disparities in health inequities. And then COVID.
Blew up, huh? Just kaboom.
It just blew up everything.
Yeah.
And partly, I think, because of the partnerships that I had already established, I was asked by the Chancellor, Sam Hawgood, at UCSF to join the task force on COVID and community research. And as you may be aware, there was a study in the mission around the epidemiology or the distribution, how many cases, the prevalence of COVID there was in the mission. And there was a plan to do a similar kind of work in Bayview Hunters Point. And based on my work in cancer, I already had partners in Bayview Hunters Point, so I was asked to lead that initiative.
And so when you talk about epidemiology, that is the pathway maybe of infection. How did this occur? Where did it come from?
All we can say, I think, or what we know, is that it came from or started in Wuhan, China. But we don't really know specifically where it started.
Right.
Yeah.
Now, one of the big engagements that you are leading, and you are a professor at the University of California, San Francisco, but also as an African-American woman, very engaged and committed to this community. And we know that with many diseases, you talked about disparities, African-Americans get a bit more of it than others, or they die at a higher rate. You have helped to plan a big COVID-19 testing program in the East Bay. I saw it on TV, what you did in San Francisco in the Mission District, mainly Hispanic folks. This program is going to be on the 22nd and 23rd of August at the Eastmont Mall, focuses on African Americans. Tell us a little bit about that program.
Sure. So I just want to back up and say that I was not actually involved with the mission program, the study. But as the idea emerged to do this kind of work in other communities, I got involved because of the work that was planned for Bayview. And I want to emphasize that part of the reason it was important to me to get involved is because I had established partnerships there. And I wanted to make sure that we weren't doing something that was somehow going to impair those partnerships. I wanted to make sure that they remained intact. And the efforts in African American community have a different focus than they do in the Latinx community. I think in the Latinx community, there's more of an opportunity to do sort of a study. We know that the rates are much, much higher, especially in Alameda County, in the Latinx community. The rates of COVID infection are not as high in African American populations, but the disparity for us is that when we get COVID, we die more often than other populations. And so the question is, how do you get African American folks tested and engaged with the dialogue around COVID-19? So if you look at what came out of the mission study, it looks quite different than what was achieved in Bayview. And what was achieved in Bayview was an activation of the local community to understand what is COVID, what is exponential spread, meaning that if one person gets it, 2 people additionally could end up with it. And then to get them really activated around wanting to be tested so that they know their status and understand whether or not they are putting, their aunties or grandmothers at risk.
My nephew just became infected, and he has 5 brothers and sisters and his mom. And once he found out at UCSF, he came up here from Monterey, had a new job, called mom, get everybody tested, everybody in the house. You talked about exponential infection. Now, I think one of the important things here is, as you said, the death rate is higher in African Americans. And African Americans, as we're in a very political time right now, are fearful of the police, they're fearful of the healthcare system, they're fearful of the political system, and I'll just say I am. I don't know if I speak for everybody, but I know I am, and I know a lot of people are. How do we help them to feel more comfortable? We've engaged a lot of groups in the community. One, Oakland Frontline Healers, our office, the Roots office, the West Oakland Health Center. Each of us are here for that community, and we want to protect that community and support that community. How do we help the patients, the people in the community, to feel comfortable that we are here for them?
Yeah, so all of these initiatives out of UCSF come under an umbrella called United in Health. Here in Oakland, the group of organizers that you just mentioned decided to call it Umoja Health, in the spirit of unity. So it's still under the same umbrella of United in Health. And the underlying, I guess I would call it like the secret sauce of United in Health, is that the test site itself is really run by volunteers. Mm-hmm. So although we have professionalized the collection of specimens, the swabs, and then we'll be doing antibodies, which is a blood draw if people want that, that's professionalized. But the rest of who walks you to your tent, who checks you in for registration, it is critical that group of people is represented by the community. And with all due respect to the medical professionals in the community, there is a way in which taking it out of the hands of institutions, of specific professionals, of really putting it in the hands of the community, the people who are on the ground all the time, every day, has a magical effect on the participants. And I just, again, will say, go back to what happened in Sunnydale and Bayview, which is that we heard a lot of the suspicion around, I don't trust the government. I think they're trying to put corona on my nose. I mean, we heard all of these things. And what helped us get over that was having community leaders take the test, film it, put it on their Facebook, make a statement about the importance of it. And so what we're saying is, effectively, it takes the community to save the community. And the other thing I'll add is that, Roots Clinic probably is doing the lowest barrier testing in Alameda County and in the city right now. I mean, their lines are out the door. But when you look at who tests there compared to who they traditionally take care of, there's a big discrepancy. So on a daily basis, they take care of 85 to 90% African American community. But if you look at who gets their testing there, it's only 20% African American. And for me, that's an inequity. Because it's available, but it's not getting to the people who actually need it, because we're the ones who need to know so that we can stay safe and stay alive. So I have developed a little bit of a theory about why things worked so well in Sunnydale, that it took me not until after we finished the initiative that I realized there was no branding. It didn't say UCSF everywhere. It didn't say Department of Public Health anywhere. Mm-hmm. It just said health fair. And then when you were greeted by your local community members, I think people felt like they were being asked to be healthy by their community, and they were being offered support to be healthy by their community, not by an institution. And so there's a new level of trust, I think, that we now have in San Francisco that I'm hoping that we can generate here in Oakland as well.
That's so important, and you'll always hear me say that if you knew better, you could do better. Now, tell us a little bit more about the specifics of this event. It's going to be Saturday and Sunday, August 22nd and August 23rd, and you will hope to screen 1,000 people a day?
Yes, we have the capacity to test 1,000 people per day. We will have both drive-through and walk-up. You do not have to pre-register, although if you decide to pre-register, you can go to www.unitedinhealthoakland.org, and you'll see big buttons both for volunteering and for registering. Volunteers do get tested if they would like to be tested as well. You don't have to have symptoms. You don't have to be a frontline worker. You just need to show up.
Do you have to have insurance?
You do not have to have insurance, and all the testing is free. You will not be charged for it. It is being donated by the Chan Zuckerberg Biohub, and they will conduct all of the testing free of charge.
How long will it take for people to get their results back?
Great question, because we know the rest of the country is facing like 5 to 7 days of a wait, which is kind of pointless. Our tests come back in 48 to 72 hours. In the past, the testing on Saturday, the results come back on Monday.
Okay. And we'll be giving away personal protective equipment, masks, hand sanitizers. This is what the testing kits look like. You have a swab, you have a tube. There is no coronavirus on this swab.
There's no coronavirus on the swab.
When you open this up, it's been safely put away for some period of time. This is a chance for us to look at the African American community, and as you said, we really want African Americans to come out and be tested. It's free. There'll be food there.
Yep, there will be food. We'll have a DJ. There will be a social services pavilion on the lot on 73rd and Foothill. And that pavilion will provide food to address potential insecurity, which a lot of people are facing right now with coronavirus. We'll also have an opportunity for voter registration, because that's how we amass power and change things. The census will be there. That's how we bring money into our communities. So we want people to participate in the census, but we'll also have information about housing. We'll have books to give away from First Five, who's partnered with us. And we really want to be addressing the social determinants of health in addition to doing this testing, because that's a big part of being healthy and being healthy in our community.
And all free. Free food, free personal protective equipment, free hand sanitizers, free testing, free social services, all of these types of things really put together by the community.
That's right.
And we are so thankful that Professor Kim Rhodes, professor at University of California at San Francisco, but also a community activist, is really here today to help us with this program. We'll have others from the community here on today's special edition of the Healthbeat Show. We thank you, Dr. Rhodes, so much.
Thank you so much for featuring it.
All right. God bless you. I'm Dr. Jeffrey Watson. Stay tuned. Your health is your wealth, and when you have your health, you have everything. We'll be right back. Hello, I'm Dr. Jeffrey Watson, right here from the Healthbeat Show, encouraging you to come out to the Eastmont Mall on Saturday and Sunday, August 22nd and August 23rd, for a COVID virus screening. We're having a big event. There's going to be food there. There'll be a DJ there. We will be talking about housing, social services, supportive programs, but we will also be testing for the coronavirus. It is free. There is no virus on this Q-tip. This is geared toward African American patients. You know, there are disparities in disease, and we're finding that when African Americans get the COVID-19 virus, they seem to die at a greater rate than many of the other racial groups. We'll be joined by a lot of community groups, by Roots, by the West Oakland Health Center, by your church, by your community groups, by the Friends of Frank Staggers. all types of organizations, and we're here for you. This is put together by you for you. Community groups. University of California, San Francisco will also be supportive, but they are not in charge of this event. You are in charge of this event. We will be giving away also free personal protective equipment. How many of you need a mask? We'll be giving away hand sanitizer also. All of these things will be free so that we can make sure that you are healthy, because you're always going to hear me say that your health is your wealth. And when you have your health, you have everything. I want to see you August 22nd, August 23rd at the Eastmont Mall. Come out, get screened. I'll be there. I'll be getting tested too. It'll be just me and it'll be you. Okay? A whole bunch of folks there testing, supporting, having your back. And if you do come up positive, we'll tell you rapidly within a few days, and we'll also direct you on what to do. If you don't have health care, we'll direct you to appropriate health care and supportive mechanisms. Okay? I'll see you there August 22nd, August 23rd, Eastmont Mall, lower level parking lot. It'll be a wonderful day. I'll see you then.